AstraZeneca was approved today. This is one of the pharmaceuticals, you had secured doses from. So when should Canadians expect a first batch of doses from AstraZeneca?
Well, thanks for having me on, Joyce. And I just wanted to mention that this is an example of the benefits of having a diversified portfolio of multiple vaccines. Pfizer's been approved, Moderna's been approved, and now AstraZeneca has been approved. And we have these deals with 7 leading vaccine manufacturers, which allows Canadians to have access to even more vaccines. We have an APA with 20 million vaccines and doses with AstraZeneca. We also have secured a deal with the Serum Institute of India for 2 million more AstraZeneca vaccines, and we will also be receiving vaccines from the COVAX facility. And so in terms of your question, we are going to see these Serum Institute of India AstraZeneca vaccines arriving in the next days and weeks. The first batch is going to be 500,000 vaccines, and another 1.5 million of those vaccines will be arriving in the early spring. So we are on track to increase our Q1 deliveries by at least 500,000. That's 6.5 million doses prior to the end of Q1. And then Q2 looks very good also in terms of having Pfizer, Moderna, and AstraZeneca vaccines coming into this country.
So I know that the timeline that you and the Prime Minister have given us is by the end of September, all those Canadians who want to be vaccinated can be vaccinated. Now I'm wondering, with the approval of AstraZeneca, with these extra, 20 million doses coming in, can you move that timeline? Is it possible that a majority of Canadians who want to be vaccinated will be vaccinated before the end of September?
Well, let me just put the numbers into context for you before answering that question. Let's be clear that 6.5 million vaccines in Q1 alone, and then with Q2 and Q3 deliveries, we are going to see approximately 107.9 million approved vaccines coming into the country cumulatively. That's including the 6.5 million vaccines from Q1. And so you're right to ask the question of whether the timeline could move up. And indeed, I am being cautious at this point in time, continuing to use the end of September timeline, because we want to be certain of delivery schedules, and we want to make sure that there aren't disruptions in the supply chain like we have seen in the past. But if all goes well, we hope that that timeline would move up, but we will continue to work with the Public Health Agency of Canada on that estimate.
I can understand why you're being prudent, and you don't want to give people false hope, especially on something that is actually becoming a very emotional topic. Who knew that vaccines would become such a hot topic? But I'm wondering, because you have to rely on delivery, if the fact that 20 million of those new vaccines, the AstraZeneca, are going to be coming from the States, are you hoping or expecting it to be easier because they're next door? Or you figure it doesn't matter if they're this close, there could be 100 different things that happen and there could be delays just the same?
Well, it's an excellent question, and I'm really glad you asked it. So the question of where we're getting our doses first needs to be answered. The AstraZeneca contract for 20 million doses sees those doses coming from the United States, and the 2 million doses from the Serum Institute of India will be coming from India. That's totaling 22 million doses of AstraZeneca in total. In terms of our deliveries from the United States, we've been in close touch with our Ambassador Hillman, and the U.S. government. We do not expect any concerns or delays at the U.S. border at this point. And so once we iron out the delivery schedule with AstraZeneca for the Q2 and Q3 deliveries that we are expecting, we will make sure to share that with the provinces and territories. But at this point, we don't expect any delays in those deliveries because of border issues. And in terms of the deliveries that are coming from India, we have had the diplomatic end of the signing sign-off already occurring. Our Prime Minister spoke with Prime Minister Modi, and we have been working very closely with our Indian counterparts through our High Commissioner, Nadir Patel, who's done a wonderful job for us in terms of lining up all the pieces in this puzzle that need to be done prior to the delivery of these doses.
I'm just asking you, and I want a quick answer on this one. So if you're getting all these doses, 20 million from the States, 2 million from India, are you giving up on those 1.8 million doses from COVAX, sort of the international vaccine distribution program? Will Canada consider giving those up, yes or no?
I want to make sure that you know that we are going to share any excess doses with the developing world. That's why we put $220 million into the COVAX facility. That's why Minister Gould is taking a role in governance of COVAX. And so we still need to iron out delivery schedules for all of these AstraZeneca doses in terms of when they are particularly arriving, and as I said, any extra doses that we have in terms of our global portfolio, we will be sharing with the developing world.
So I'm guessing your answer means that if you don't need those 1.9 million doses, you will be sharing them. Thank you so much, Anita, Anand, for these explanations, and have yourself a great weekend.
And you too. Take care.